But for this month and next month, we are going to be focusing a little, we're going to do it a little differently, and we're going to focus on Penn State and our program specifically. So tonight what we're doing is we're going to have one of our Penn State librarians talk to us about using our library portals, different library resources that are available, and also some specific things about public health and homeland security that will help research in those specific fields. Next month, we are going to have our option director, Dr. Jean Langridge, who's on tonight with us, specifically talk about our program, and he is going to give an overview of the program. He's going to be answering, it's going to be a webinar PowerPoint, but it's going to be answering a lot of questions that we've gotten from students in the past. So we're going to be giving you a lot of information about what to expect as you go through the program. And he's also going to be presenting a webinar that focuses on the capstone experience. This is going to be early for some students, but we learned through speaking with other students that they really would have liked more exposure to the capstone earlier. So we want to, again, front load you with all this information so that way you can think about it as you work through the classes. That webinar is going to be on October 2nd at 8 p.m. Eastern Time. Our webinars are always on the first Wednesday of the month at 8 p.m. So we have a whole semester planned. So if you want to save the date for every first Wednesday at 8, I think you're going to have some interesting speakers coming up. And the last announcement before I turn this over to Andrew is I am really excited to announce that in the spring we are going to have a new elective. I did research on non-medical obstacles that can affect public health responses, and I'm going to be making that into an elective. So that's going to be offered as PHP 897. There's going to be more information coming out about that, but I'm very excited about that, and I'm looking forward to teaching it next semester. So with that, I want to introduce Andrew Dudash, who is one of our librarians in the Penn State Library. And Andrew, thank you so much for speaking with us tonight, and we look forward to hearing what you have to say.
Yeah, thank you, Jennifer. Can everyone hear me clearly?
Yes, we can.
Yeah, that's great. Okay, well, welcome everybody. You currently can see my my screen, my video screen with me in my office at University Park on the right-hand side, and then you should be seeing the Penn State University Library's website on the screen share. And so, you know, at any point in time, if you have any kind of questions, please feel free to stop me and ask. You know, as Jennifer said, my name is Andrew Dudash. I am the librarian for political science, policy studies, and government information. The university libraries are a federal depository library program member, and so I am the representative for our government documents collection. You know, most of our documents these days are collected electronically, added to the catalog, and very easy to find through the catalog. And I'll be pointing some of those out this evening. You know, the university library's main page is, you know, that's our common gateway to, you know, everything that we have access to, whether it's databases, electronic journals, course reserves. You know, the find box that you see on the main page, that's our what's called a federated search. That searches multiple databases at the same time. You know, in addition to that, and the blue bar above the find box, we have our services link, our research link, and a number of other things. And then below that, you're going to see research help and tools, databases by subject, databases A to Z, our subject guides, and then also you can see our subject experts. You know, we have some other experts within the university libraries that are, you know, within the realm of, you know, nursing, allied health, and so there might be some instances where someone else might be of use to students in this program. So you know, and you'll see the faces of the subject experts as we, you know, maybe as we we go look at a guide or as we move through this evening. So the first thing that what I was going to do, how I was going to work this evening is I was actually going to talk about resources and some searching and some areas that are that should be of interest and should be helpful for students in the PHP program. And then I was going to kind of finish up with some of our how-to guides and some of our services at the end. One of the main services that I'll talk about that's helpful for students in enrolling remotely is we have book delivery and we have interlibrary loan service for everyone in the World Campus program. So that's something that I'll point out as we finish this evening. But as far as that goes, okay, so we've got the main library page. The Federated Search, again, looks at multiple databases at the same time. Underneath the Federated Search, you can actually do an advanced search within the Federated Search, and then you see the two links that says Search to Cat, and then try our new libraries catalog. I'm going to be showing everyone the new libraries catalog. If you're new to Penn State and haven't searched the catalog before, learning the new catalog I think is the best strategy moving forward. So that's actually where I'm going to start this evening. Is I'm going to start in the new catalog. So from the library's main page, if you click on try the new libraries catalog, and if you're following along at home and you have a web browser open, feel free to open these resources up and follow along with me. So what I'm going to do at this rate is I actually, the search that I think illustrates a number of things really well with the new catalog is a search for public health preparedness. So that's what I'm going to do here. I'm going to put that search in quotes because I'm looking for the phrase public health preparedness. And now that's a pretty specific type of search, but I'm really using it to kind of illustrate the different types of things that you'll see in the catalog when you're searching. Okay, so this is public health preparedness in quotes. So I'm looking for the phrase. 174 results. We can sort by relevance, or we can sort by year as well, which would be the date. Those would be the two most important ways to sort. But just some of the things that you'll see, essentials of public health preparedness, that looks like a textbook. When we look at view availability, that's actually a print item. You can see that it's held in Harrisburg. There's a call number there. And then material book, the location being transferred between libraries. And so that's an interesting thing. The way that the university libraries work is if you're in University Park, but you have a book that you want that's in Harrisburg, you can request it with this I want it button here. And the book gets sent to University Park from Harrisburg. And then sometimes we'll retain that book on the shelf at UP until someone else requests it at another campus. So our books move around. Consequently, if you were enrolled in a World Campus course and, somewhere within the United States, if you clicked on the Want It tab, we actually have provisions to deliver that book to your door, through our system. So that's something that is available, and I'll talk a little bit more about that near the end. But looking at some of the other resources, here's a RAND publication from 2004. Another title from 2011. It looks like it's held in Harrisburg as well. And now that one says Stack's General Collection, so that means that it's on the shelf. Record number 4 is interesting. Record number 4 is actually not, our catalog includes books and also journal article or journals, periodicals. So this particular publication, Disaster Medicine and Public Health Preparedness, you know, exists as a resource, not a book resource, but a periodical resource. And so if you would click on this Access Online, it's going to show you the how you might have access to it. So, and so that's a Cambridge journal, and it tells us that the availability is 2014 to the present. So we would follow that link, and we'd have access to that specific journal for those years. So we go back to the CAT. Okay, so record number 6 again is Emergency Ethics, Public Health Preparedness and Response, an edited work. It looks like it's held in multiple places. It's held at Greater Allegheny and also here on the 4th floor of Paterno. And then record number 6, different type of resource than when we've seen mostly books. Record number 6 is a government document, right? So we've got pandemic influenza appropriations for public health preparedness and response. The Congressional Research Service puts out all kinds of reports. And so if we, if we were to click on the title of that, that's going to load the detailed record. Gives us a little bit more information about it. But, moving forward to get the full access, if we click on this easy access libraries.psu.edu, that's going to take us to a government document database that we subscribe to called ProQuest Congressional. And oftentimes when you're in the catalog or when you're in our Lion Search or Federated Search, you're going to find a link, and the link is going to link you out to another resource. So in this case, it links me out to ProQuest Congressional for CRS reports. CRS reports are available in many different formats. In this particular case, it just links us to ProQuest. But you can see the PDF full text of that document is available in this instance. Okay, so back to that set of search results. I'm going to back up twice here. Okay, so this record number 7 is another document, and if we look at that document, right, we see the title a little bit different. CRS is produced by the Library of Congress, where this particular government document you can see is Health and Human Services, the OIG, and oftentimes, almost, when you find an electronic government document through our catalog or through our Federated Search, you're going to see this PURL fdlp.gov, and the PURL is short for permanent URL, and generally they are permanent, but we do find instances where PURLs are not permanent. And so if that were the case, you want to reach out to me specifically on that one and alert me to the fact that that's the case. So I didn't test this, but we'll go ahead and jump right to that PURL. And in this case, it's actually linking us to the Wayback Machine on the Internet Archive. Maybe the PURL has changed, but that's that's a search in our catalog, located a government document. Our catalog provides the proper link, and here we are to the to the full text of the resource. So the seamless access is pretty impressive throughout our library system, and that's just a kind of an example there. So I'll jump right back to the catalog. You can see the next document is a CRS report. There's record number 10. That's a thesis, right? So that actually looks like an honors.libraries.psu.edu from 2014, and this could be an undergraduate honors thesis. So we want to kind of consider consider our sources there. You know, this might be a really good resource. And it would also have a bibliography that would probably be very informative for a researcher moving forward. So that's a really small sample of things that you'll see in the catalog. You can do some limiters here over on the left as far as access, format, campus. You know, the one type of limiter that I'll use often is government document. But in this particular case, you know, the search public health preparedness is going to, you know, that's in the realm of government. So you're going to find a lot of resources that are going to be government resources. So, so I'm going to step out of the new catalog, and I am going to go back to the University Library's main page, and I'm going to now go into the Federated Search, which in the find box, you know, I'm not going to do an advanced search, but one thing that I'm going to do is I'm going to do public health preparedness in quotes. And then some of my searching is going to be a little bit more specific as I move forward here, but I just want to illustrate a few things with these types of searches. So the Federated Search, the way the Federated Search works, it searches multiple databases at the same time, and then it delivers these resources. It basically categorizes these resources by type. So we've got a set of journal articles that we found, 6,732. Books and media, we found 371. And then news and magazine articles, 5,543. Generally, when you do a search in our Federated Search, the news and magazine articles are going to be a lot more voluminous than the journal articles, simply because news and magazine articles are published on a daily or weekly basis. In this particular case, that's not the case actually, and that doesn't always ring true. But at this level, the most important thing that you can remember to do when you're at this Federated Search, and I'm going to do this for the journal articles, is you don't want to click on one of these first three. What you want to do is you want to click on the See All references. You want to see all 6,732. And that might seem to many people like, wow, that's too many results. I can't look at all of those. And I'm not following that link to look at all of these records. I'm basically just setting myself up to kind of study the landscape of what the database is showing me. So we're, at the very top of the screen, it reminds you of your search. It gives us the results sorted by relevance. We could change that to sorted by date. And then we're starting to see our results. Nerve agent incidence and public health preparedness. Authors from the Annals of Internal Medicine, January 2019. Okay, so at this point in time, I like the Federated Search because I can cast a broad net out to multiple databases at the same time, and I can kind of get an idea of the landscape of what's being written, and also what I consider the landscape of the terminology, because one of the things that databases are useful for finding like information, finding like academic information on many levels, but they're also useful for just kind of learning more about a particular topic and learning the landscape of the terminology. And so one of the examples of kind of understanding terminology that I use, and I use this example with many classes, is in food history or cooking, there is an official subject heading that's referred to as cookery. And cookery, is generally a term that no one ever utters in their kitchen. But cookery is a term that really will link you to wonderful material on, wonderful cookbooks, wonderful books on cooking history. And so, we will often find terminology when we're doing academic research that maybe we didn't think of before, or maybe we didn't link to the particular subject that we started searching for. So, one of the things I like to do is I like to use these results lists as a way to mine or harvest terminology out of the database to make my searching more effective. So how do I do that? I look at the titles, and then in this format, if you click on the preview link, what you'll see is the basic record, and then you're going to see a little bit more detailed record, and we're going to see the abstract recent use of nerve agents by terrorists and assassins exposes the need for public health responders, right? It tells us the source, and then in the subject headings, we're going to get subject headings. So we've got medicine, general, internal, organic chemicals, emergency preparedness, terrorism, public health. Not as many as I would like, not anything there that's really unique, although public health preparedness is a phrase and emergency preparedness is a phrase. They're in many ways I would think that those are working in the same realm, but also they're divided in some ways. So those are things that I consider when I get into these databases. Some other things as far as functionality is concerned, when you're at this level, as long as you're, I think everyone should be familiar with two-factor authentication. Two-factor authentication is, if you're accessing your Penn State email, or if you need access to our resources, you need to make sure that you're authenticated through the Penn State system, because when you click on this journal article full text online, it's going to open up another window, and if you're two-factor authenticated, the system's going to recognize that you're coming in through Penn State, and it's going to give you the full text of the article when you find it in the database. So I'm going to go. Ooh, that's not what I wanted to do. Okay, so I'm going to go back to this. I'm going to go back to this results list here, and to the right of the titles that you're going to find in the Federated Search, you're going to be offered a permanent link, which may be helpful for citation purposes.
Andrew, I'm sorry to interrupt. I think we lost your share screen.
Okay, sorry. I might have kicked behind my... You lost my... Oh.
Got it. Thank you.
All right. I'm not sure what I did there. I apologize, everybody. Okay. So I'm going to, did everyone pick up the two-factor authentication? I know I was talking about that. The two-factor authentication will ensure that when you see a full text online link, that you're going to have access to it. Some other important features related to this particular interface in the Federated Search, you're going to see the permanent link. You're going to see cite this item, so you're actually going to be able to start generating citations. You can email the item to yourself, and you can actually start to save these items so you can collect many at a time. Some other things that you can do on the left-hand side of the page as far as refining your search, we're within the realm of journal articles. We could take our publication date and, let's just look at the last 2015 to 2019. That cuts the search in half. If you scroll further down on the left, you can see that database likes to give us disciplines, so public health, social work, welfare and social work, medicine, biology, education, and then some more, and then some additional subject terms. So that's that's the type of that's the type of thing that you're going to see in when you do the federated search. And now this is just one basket in the federated search, so we follow the journal articles. Now some other things that you can do at this level is you can go up into the search box, right? And you can narrow it based on a search term. So I'll combine public health preparedness and Ebola. And so that takes our result down to 480 again, and this is just 2015 to the present as far as my date limiter goes. So this is a pretty good set of results. And again, these are sorted by relevance. If we change that to date newest, you're going to see it. This is strictly by date. So the last one is May 2019. So that's the federated search. That's the journal area of the federated search. If I'm going to go back to our search. And so, and at this level, we could limit our search again, public health preparedness, but if we look at the books and media section, if we see all 371 results. Now, I started out searching in our catalog, which is mainly our collection of books, and then what we have for journals. But this is a similar result, so we're going to probably see some similar things. That Essentials of Public Health Preparedness by Rebecca Katz, that was what we saw. It's in transit in Harrisburg, so we saw that in the CAT search. And for the most part, it's going to be very similar. And you can see that's fourth record there is available. It's a government document. The emergency ethics, we saw that. So this area of the federated search is very similar to searching the catalog. I generally will start with a federated search regardless of what type of searching I'm doing, because I kind of always am curious as to what the landscape of the of my search looks like. And the federated search, because it searches several hundred databases at the same time, I really like to see that. Now, oftentimes the federated search is going to lead you into a more specialized database, and that might be where you spend just as much time. But I really like to get an idea of the landscape of what's being written, the landscape of the terminology with the federated search. There's the ability to start to build bibliographies and really kind of build a foundation. That's why I like that tool. In some cases, I think a lot of people can use the federated search exclusively. But in many cases, you're going to need to be using, multiple databases, or in the case of a systematic review or something like that, that's on another level where you're going to be, looking at many, many, many areas. Okay, so that's, the federated search. So now let me see if I can move about here without losing my share. So I'm going to go back to the University Libraries page, and I'm going to go into, let me see what search. Okay, so I'm going to go to databases A to Z, and I'm going to go into M, and I'm going to go to Medline. Oh, you know what? That's not where I want to be. That's not the Medline I want to show you all. No, that's not it either. I apologize here. Okay. So I prefer the PubMed interface. This is the interface that I ran some of my searches on. You know, I think ultimately there's some preferences that you'll have, but you know, Medline kind of gives us a different set of results than what the federated search and what our catalog gives us. And the search that I thought was interesting was a search for public health and Ebola. Put public health in quotes. And, you know, maybe some of you are familiar with Medline. You know, search results, 2,130. I think these are sorted by the most recent. But, you know, in many ways, some of these are very clinical. But depending on what you're looking for, they could be useful. One thing that I liked about this search was the opportunity to point out record number 5. Ebola virus, a global public health menace, a narrative review. And so it's from the Journal of Family Medicine and Primary Care, July 2019. So, and it's a free PMC article. I would think we'd have access to it from Penn State, but when I follow the link and then I click on this full text link, do you see that in the share? Right. So this is the full text of the article, and I mean, I really, you know, this is as up to date of a review about Ebola and global public health. You know, so the you know introduction, and you know, it goes to the taxonomy, transmission, source of infection, some really great, you know, and I guess I envision this as something as a really great tool if someone was going to be delivering information to the public on Ebola. This would be a great foundational document, not necessarily that you would share with the public, but that you would use to create some really good public health information for the public, you know, and even give some, you know, some historical, you know, it's as thorough as, you know, as it gets. So, you know, reviews, narrative reviews, a review article on a particular topic. Review articles are very helpful because, you know, oftentimes the bibliography is going to be as complete of a bibliography as you're going to see on that particular topic. So, and I didn't even look at the bibliography on this article, but I'm sure it's extensive. And you know, as thorough as it gets. So let's see here, you know, 66 references. So, you know, I always think that review articles are very good resources to pay attention to. And so that's, you know, that's kind of, that's, you know, that's just a very quick introduction to PubMed. Some other resources that I wanted to talk about, if we go back to the, oh, that's not, did I lose the share again? Is that sharing again?
Yep, we have it back now.
Okay, yeah. The tab that I want to go on is up near the stop share button. I think that might be what the problem is. But okay, so this is, so that was PubMed. If I go back to the libraries page, we have some other databases. If I go to databases A to Z, and I go to the P's, it's a database called Public Affairs Information Service. That's a global public affairs database. That's a resource that, if you're going to be thorough in your searching, I think that's in play. Go back to the databases. JSTOR is another database that I would think that would be in play for this particular type of research. Project Muse is another resource that's available. There's a resource called CAB Abstracts, Agriculture, Nutrition, and Global Health, right? So it's kind of covering the global health. Not as CABI isn't as large as PubMed is and some of the other databases, but it provides a unique global health perspective. So it looks a little bit different, but this is one of the this is another resource that you should be aware of. So go back to the databases A to Z page. There's a number of other resources, that I've, CINAHL is Nursing and Allied Health. So, there's several, and I think, in the Cochrane library as well. So there's a number of resources on the A to Z list, probably a half a dozen or so that are really key to, and you want to be bookmarking these resources or collecting these resources in one place, so you can kind of be systematic about how you're searching, and also ultimately depends on what your topic is going to be. At any point in time, if anyone is starting the research process and is unsure where to start, I always will start at the Federated Search and then kind of narrow my topic down, narrow my terminology down, and then depending on where the Federated Search might lead me, I might be in that database doing a little bit more of a detailed search. So, probably the best thing that anyone could do entering a graduate program is to really kind of get to know this A to Z list, get to know the databases that are available. And it's overwhelming because there's a lot of databases, but spending some time with it and getting to know them it will pay off as you move forward with your research. So a couple other things that I wanted to talk about that off of the library database or library databases would be I'm not sure if anyone uses Google Advanced Search or not, but years ago it used to always be linked right under the Google thing, and they took it away. So but if you search Google Advanced, you can find the Google Advanced search form. And the nice thing about the Google Advanced search is you obviously can you can search all these words or exact phrase. So let's just do and I don't have to put it in quotes because I'm in the exact word or phrase search box, right? But then the most powerful thing about Google Advanced Search is the domain limiting. So if you look down, I clicked in this site or domain. So if I do a .gov limiter, and then I click Advanced Search. Basically what the Google Advanced Search is, it's allowing us to filter by domain. So this isn't going to be limited necessarily to U.S. federal government, because many states use the .gov limiter as well. So you can see this record number, or this record here is West Virginia government. So, but this is actually an interesting search, because you can pick up a lot of information on different states' public health preparedness plans or information, right? And then the other nice thing about this particular search is it's going to pick up articles from PubMed, because PubMed is a government database. So that is in play. So I don't know if anyone's ever used the Google Advanced Search before. You can search. You can limit to. You can limit by language, region, or you can even limit country domain. So there's a number of things, and you can be specific with your domains limiting. So you could limit to just a particular section of the CDC, or limit to a particular state. And so those are types of things I think that are helpful. One of the things that we see in especially in health information is something called gray literature. And so gray literature, and I have a couple really good guides pulled up. We actually don't have a gray literature guide at the university libraries. We have some guides that talk about gray literature, but the Duke University Medical Center Library has a great guide on defining gray literature. So, gray literature is produced on all levels of government, academics, business, and the industry, print and electronic, not controlled by commercial publishers. So, the gray literature oftentimes doesn't necessarily make it into a database, but government is a large producer of gray literature. So that's something that you might not think about a resource as gray literature. It might be in front of you, but if it's not produced by a commercial publisher, it would be considered gray. Sometimes it's harder to find. Sometimes they're, that's part of being thorough. And so the examples would be presentations, proceedings, regulatory data, government pubs, reports, working papers, dissertations, thesis, patents, policies, and procedures, right? And so then there's another gray lit guide from Penn. This guide actually gives some really good information on why it's important, what it is, things like that. So these two, and if you just Google gray lit guides, I think these are on the top of the list, and so that's something that you want to get to know as well. I want to mention something that wasn't on my agenda, and then I'm going to go back. I'll finish up at the how-to page. The university libraries, Penn State is a member of a group called Icpsr. And Icpsr, and it's available from our database A to Z list, but it is data sharing consortium of research libraries where people actually can deposit data for other people to use. So Penn State is a member. So as long as you're coming in through a Penn State machine, it's going to recognize you. You still have to log in and create an account, but you can go to Icpsr and search. And I don't know if I searched public health preparedness or just public health, just to kind of get an idea of what the landscape for this type of data is in Icpsr, because I had never done this search before. And public health preparedness, I think I might have just searched public health. So let's just back up on that. And so public health preparedness produced 9. Public health produces a lot more, but you can see the types of things. Public health on the agenda of counties, 1993. Integrated public health surveys, 2010 to 2011. Alcohol studies, national longitudinal survey of local public health systems. So some really, and these are all going to be, available in these are all data sets. So these are all, there's going to be code books, and when you click on these, you're going to see, it's going to talk about, variables, data and documentation. If there's some secondary literature that's been written related to these particular data sets. So Icpsr is a great resource to remember that's out there. Okay, so now I'm going to go back to the library's main page. And when I click home on my browser, the library's page comes up. So, probably, if you have a laptop, you have a go-to research machine, bookmark the library's page, make it something that you check out on a, frequently, so you can kind of get an idea of what the landscape of our organization and what's available. But if you go to the library's page and you click on services, under interlibrary loan, there's a World Campus and Distance Researchers page of the interlibrary loan, right? So there's a under services, there's a number of things that are going to be pertinent to everyone tuning in here this evening. In addition to that, if we go to research, go to the research, the how-to guides. If I click on the how-to guides, the how-to guides are going to mention all kinds of important things. There's citation guides. There are guides related to citation management software. So, we have citation generators that exist in our databases, and EasyBib is a citation generator. But then there's also these resources, EndNote, Zotero, Mendeley, and those are citation managers, and those are basically plugins to let your browser talk to Word to make the systematic integration of resources into your writing much easier. My recommendation at the very bottom of these library tools is the Zotero guide. Zotero seems to be the most commonly used resource for grad students, at least. That's my informal assessment of that. Zotero's free. It seems it's relatively user friendly. So that's something you want to consider. We have a maps and geospatial how-to guides. If anyone wants to integrate GIS into your public health research, that's something that we have subject specialists and experts here to help you do that. We also have something called the Data Learning Center, that the Data Learning Center, you have a data set that you found and you want to kind of explore that data set in a number of ways with maybe a specific tool. You can make an appointment with the Data Learning Center, and they can do a consult with you as far as the types of things that you might want to find out about the data set. Some other highlights of the how-to guide. I mentioned citation managers, the Data Learning Center. We have a guide that's called If I Apply. And the If I Apply guide, actually, it rests in actually it's a general guide now, but If I Apply is an idea and a tool to identify bias and resource credibility. So, basically you can run your resources through this If I Apply process and get a sense for how credible they are and kind of where they fit in the larger landscape of what you're doing. So that's an interesting guide. Improve your research skills, searching the cat, concept maps. evaluating information. There's a Google Scholar tutorial, which I didn't even talk about Google Scholar. I showed you the Google Advanced. You can get Google Scholar to talk to recognize Penn State, that you're a Penn State researcher, and so Google Scholar is going to work seamlessly with our resources. You know, there's how to use Iliad to request articles tutorial. You know, you may run into an instance where you don't find an article in a full format. We have an interlibrary loan service that is exceptional here. You create an account, it's tied to your two-factor authentication, and it's going to auto-populate the form, and then it's going to text you or email you when the article is available, and it's going to be instantly, you know, it's going to be available within, you know, it seemed, I have not waited more than 48 hours for an article that I've requested. So that's an incredible service. You know, most importantly, as we wrap up, is to reach out to the university libraries, reach out to me, reach out to whoever whoever you might need to. We're very responsive. You know, any question that you might have that could be large or small, you know, I'm gonna either answer that question instantly, or I'm gonna get you to the right person who can answer that question. You know, I enjoy learning new things every day, and so the researchers that bring me new questions on a daily basis are really kind of what keeps me going. So, you know, no question is inconsequential. So please reach out to me, utilize me as a resource. I mean, we have 750 databases. We have all kinds of human resources available in the library. We have all kinds of external resources available. So, you know, just utilize us, utilize the library webpage, utilize me as a resource. You know, you pay for these resources, and you know, your experience, your academic experience is going to be enhanced by getting the most out of those resources. So I didn't leave a whole lot of time for Q&A, but I can stick around if anyone has any questions. So thank you.
Thank you. I wish I had come to you before I started my dissertation. We have one question to kick it off. Gavin wants to know if he can, sorry if there's feedback. He wants to know if he can link specific databases directly into his Canvas lessons. You're muted, by the way, Andrew.
I think that's possible. Chulapal, do you have, that might be is that something that you've done?
I'm sorry, I missed the question. I was looking at the mute and unmute thing.
Yeah, the question was linking databases directly in Canvas.
I think that there's a library resources that's already linked in Canvas in every course. So that should take them to a library search page.
I'm certain that's possible. I don't, you know, with the authentication, I'm not sure if there's a proper way to do that. If we go, let's just go back, and if I go to databases, and let's, yeah, so that, I think that link at the top there is the link that you'll use, and as long as they're authenticated, they should be able to pass through. I think that's the process. I could follow up on that to confirm.
Technically, I think it is possible because, I mean, in order for you to view your course in Canvas, you are already authenticated. So if you place that link in Canvas, it should take the same authentication as that you did with Canvas. And then go directly to that database search.
Okay. I know, I embed links in my library guides to specific databases, and I think it's the same. I think that's the same process. So that certainly is possible. I think ideally, I think what would be really complementary to this session is a subject guide that's going to have all of these pertinent resources in one place, similar to some of our other guides. And I think, Jennifer, that's something that we can maybe work together on moving forward to kind of, it would be nice to have that jumping off point for new students. So.
Andrew, this is Gene Langrich. This has been fantastic. Thank you so much for spending your time. I really appreciate this. I think it's going to be great help for people. I just want to make sure that we also put your library, the Penn State University libraries, in context for the broader range of folks here. They may come into a situation where they land on the homepage for Penn State Hershey Library or the Penn State Harrisburg Library, but from what you've given us here, the place I direct everybody to is the Penn State University Libraries, what you've just showed us here. Absolutely,
absolutely. And I think, if you use the libraries.psu.edu as the launching point, it's going to, that's the best course of action, because you're going to have access. That's going to provide the greatest access to everything that you'll find there is by going through that. Of course, if it links you to something and it recognizes that you're not two-factor authenticated, it's generally should just bring up the script to authenticate, and then access should still be seamless. But yes, I mean, the university library serves, we're it's plural because we serve everybody. So that's why that's very deliberate that it's the university libraries. And so, Harrisburg is under us, Hershey is under us, there are some unique things as far as access goes, related, like the law school has access to some things that we don't even see, right? And I'm not sure about Hershey. I think there might be a few things that they license not for the university libraries. They just license for medical school students. But in this particular case, university libraries, we're built to serve in this with this constituency, and I think we're doing a pretty good job as far as what we have available. So yeah, I'm quite impressed, and I think this is a place we direct all our students to first. I mean, and it's hard to give it justice in an hour. We can, you could, there's a number of things, but I think we should collectively talk about a subject guide. I think, and I think that would be something that would be the best thing to embed into Canvas moving forward. Great, thank you very much. Certainly, thank you.
So Andrew, on the page that has the all the different subject matter experts listed, are you listed there for public health preparedness now, or?
I'm not.
Okay.
And so that's kind of been an internal discussion, because the subject experts, that was rolled out last year, and it is not comprehensive. And so your question, really, that's in the pipeline to kind of add some of that, because we have some things. There are actually some departments that we serve at UP, and they're not even listed in the subject experts, so it's not complete. And so on my to-do list is to kind of try to work towards enhancing that. So if someone searched for public health or public health preparedness, they might find my name. So that's something that we're working on, and it's not. Unfortunately, if that's not something that I can go in and change myself, or we would have done. So that's kind of, we have to work through some bureaucracy to get that changed.
So thank you again for offering to be used as a resource. And we will definitely, when I post the recording, I will also put your email address on that, if that's okay with you.
Yeah.
But if they were to use like the chat, and they ask a librarian chat, would that get to you as well if they had specific questions?
The Ask a Librarian chat, it may get to me, but it might not. You know, I actually do a couple hours a week on the Ask a Librarian chat, and I didn't do any referrals today. It was basically I was able to answer the questions because they weren't questions that needed a referral. They were, you know, I need a book for this course and I can't find it kind of questions. If someone were to come in, you know, if someone were to come in and ask a question about public health and government resources, I would get that referral, right? So one of the things that as we enhance the subject experts and the subjects that we support, that's going to be something that someone would, maybe if it was just public health, but it wasn't government related, someone would maybe refer me. But they could also refer one of our other allied health librarians too. So it's, you know, that's an organic process. It depends on who they draw in the ask, right?
Okay.
But it's a very, you know, we serve a tremendous amount of people through ask. You know, my first thought would be is, you know, if you're gonna, we'll post the recording, you post my email. You know, they're welcome to ask me questions moving forward at, you know, at any time. But if they forget that and they find themselves on the ask, we're going to make sure that they're you know, they're headed in the right direction or headed to the right person. So.
Well, thank you. Okay, it's 9:07, so I'm just going to do a last call for questions. I don't see any more in the group chat, so if you've got one, you can either type it in or raise your hand. And I don't think I see anything. So, Andrew, thank you again. This was amazing. This was a lot of really, really great information that is going to be very helpful.
Great.
And I just want to remind everybody that we will be having our next webinar on Wednesday, October 2nd, again at 8 p.m. And we are going to have our PHP faculty led by Dr. Langridge talking about our program and our capstone. So that's definitely one that you will want to come listen to. Thank you again, Andrew, and I hope everybody has a great night.
Yeah, y'all have a good day.
Thanks.
Thank you so much.